Nurses not only bring medical support and healthcare, but also emotional and spiritual support to patients and families. A nurse's role reflects God's love through their compassion, patience, and integrity. Galatians 6:12 tells us, "Carry each other's burdens, and this way you will fulfill the law of Christ." Nursing is a form of service and even ministry, caring for others as Christ did. As we aim to embody Christ in our work as nurses, we affirm the dignity and worth of each patient through their care.
Bacterial cystitis is inflammation of the bladder. Most are caused by gram-negative bacteria, and gram-positive can also be involved. E. coli strains that cause cystitis are typically uropathogenic, possessing specific virulence factors. The virulence factors are the fimbriae, allowing bacteria to adhere to urothelial cells, resisting flushing in the urine, the flagella, which enable motility, helping bacteria to ascend the urinary tract. They also cause biofilm formation. Some bacteria can form biofilms on the bladder lining the catheters, protecting them from immune responses and antibiotics, or toxins such as hemolysins and other enzymes damage host cells, promoting infection. The pathogenesis of bacterial cystitis is bacteria entering the urinary tract through the urethra. The colonization and infection of bacterial cystitis happens through bacteria entering the urinary tract through the urethra. It adheres to the bladder epithelium, allows colonization and invasion of host defenses. Once in the bladder, bacteria can grow, create biofilms, and perhaps infiltrate epithelial cells. This can cause the host to become inflamed and which results in the cystitis symptoms.
As for the transmission of bacterial cystitis, it can happen in many different ways, one of which is sexual activity. Bacterial cystitis is not necessarily a sexually transmitted infection, but sexual activity can contribute to its transmission and development. During sexual intercourse, bacteria can be introduced into the urethra and then travel up to the bladder, leading to an infection. Second is hygiene. Poor hygiene can play a major role in transmission because the urinary tract is close to the anus. Bacteria from the intestinal tract can easily enter the urethra and travel to the bladder, causing an infection. Improper wiping during bowel movements or not washing the genital area regularly can transfer these bacteria. Third is urinary catheters. Bacterial cystitis can be very common in the healthcare setting, specifically in urinary catheters. When they are placed, bacteria from the urethral opening, skin, or the healthcare worker's hands or equipment can enter the urinary tract. Fourth is irritants. Exposure to irritants can increase the risk of infection by disrupting the natural defenses of the urinary tract. Products such as perfumed soaps, bubble baths, scented feminine sprays, or certain laundry detergents can irritate the urethral opening and surrounding areas. Fifth is anatomical factors. Women tend to be more prone to getting bacterial cystitis because they have a shorter urethra and because of where the urethra is positioned on females. These both put it at risk for fecal contamination. Another factor is changes in the vaginal microbiota, specifically when microbes are disrupted by things such as spermicides or condoms.
The signs and symptoms of bacterial cystitis include strong persistent urge to urinate, pain or burning while urinating, passing frequent small amounts of urine, cloudy foul urine, pelvic discomfort, pressure in the abdomen, or low-grade fever. If you do not treat your bacterial cystitis, it can lead to a kidney infection, and some common signs and symptoms for that is back or side pain, fever or chills, nausea or vomiting, or blood in the urine.
Bacterial cystitis is most commonly susceptible to antibiotic treatment. Antibiotic treatment destroys the pathogenic bacteria, or it can inhibit the growth of the bacteria at its source. An example of an antimicrobial agent that is used against this infection is nitrofurantoin, which is very effective in inhibiting the bacteria and preventing antibiotic resistance, and has a success rate of about 79% to 92%. Another one is sulfamethoxazole. Sulfamethoxazole. Trimethoprim is another antibiotic treatment used if any other methods are not as effective. So, given this, it can destroy both gram positive and gram negative bacteria. Okay. Phosphomycin is another effective treatment that targets specifically gram-negative bacteria such as Escherichia coli and Enterococcus organisms, but it lacks the strength to treat organisms in the Klebsiella and Pseudomonas groups. Pimecillinum is a less common treatment. It's usually not used in the United States. But it carries the similar properties as nitrofurantoin by inhibiting the growth of bacterial organisms that cause bacterial cystitis or can make it progress. And mostly, a lot of patients are advised to maintain proper hydration and to practice proper self care to be able to beat this infection as well.
Preventions could be that patients are instructed to use condoms as a contraceptive method during intercourse. Following intercourse, urinate to prevent bacterial cystis. It has been proven that consuming concentrations of cranberries may decrease the risk of contracting a bacterial cystitis infection. Research has shown that cranberry juice may have properties that inhibit bacterial's ability to impact the endothelial cells of urinary tract. Maintaining adequate hydration on a daily basis, and in cases of chronic bacterial cystitis infection, consuming low dosage of antibiotics may be helpful towards prevention.
Bacterial cystitis is mostly prevalent amongst women that are healthy and not pregnant. In sexually active women, the incidence is approximately zero point 0.5 to zero point 0.7 episodes per person per year. The majority of cases are caused by E. coli, and that accounts for approximately 75 to 95% of uncomplicated cases. Overall, lower urinary tract infections, including cystitis, contribute to a substantial global disease burden. One recent analysis reported that from 1990 to 2021, the number of UTI cases increased by about 66%, reaching about 4.49 billion cases globally in 2021. Women are far more often affected by men. In 2021, the age standardized incidence rate in women was about 4 times the amount of men, and it also increases with age. Mostly older adult men and older adult women are more likely to get it, and also in settings with lower sociodemographic development. All right, thank you so much for watching and tuning in and learning about bacterial cystitis with us.